Good morning, and thank you so much for taking the time to join me today. I'm Dr. CRISANTO, and I've been practicing internal medicine and geriatric care for the better part of 25 years now. In that time, I've had the profound privilege of caring for thousands of patients, many of them seniors like yourselves or your loved ones. And if there's one thing I've learned, it's that knowledge is power. Specifically, knowledge about the medications you're taking is absolutely crucial to your health and well-being. Now, I'm going to be honest with you right from the start. When I look at my waiting room on any given Tuesday or Thursday afternoon, I see a consistent pattern. I see men and women in their 60s, 70s, 80s, and beyond, and a significant majority of them are taking at least one of three medications: Amlodipine, Losartan, or Lisinopril. These are among the most commonly prescribed blood pressure medications in America today. In fact, I'd venture to say that if you're watching this video and you're over 60, there's a very good chance one of these medications is sitting in your medicine cabinet right now, perhaps next to a glass of water on your nightstand. But here's what troubles me. In my years of practice, I've noticed that many patients take these medications without fully understanding them. They know they're supposed to take them, they know it's important for their blood pressure. But when I ask them about side effects, drug interactions, or why they're on a particular medication instead of another, I often get blank stares. Now, I'm not saying that to be critical, far from it. The world of pharmaceuticals is complex, and our healthcare system doesn't always do a great job of taking time to educate patients about what they're putting into their bodies. So today, I want to change that. I want to be that voice in your ear, that trusted physician who sits down with you and says, "Look, let me explain these medications to you in plain English. Let me tell you what you need to know to take control of your health," because that's what this is really about, empowering you to be an active participant in your own health care, not just a passive recipient of prescriptions. Let me start with the first thing every senior needs to know about these medications, and that is understanding what they actually do. You see, Amlodipine, Losartan, and Lisinopril are three different classes of blood pressure medications, and they work in fundamentally different ways in your body. Amlodipine belongs to a class called calcium channel blockers. What that means is that it works by blocking calcium from entering the muscle cells in your blood vessels. When calcium is blocked, your blood vessels relax and dilate, which allows blood to flow more freely and reduces the pressure inside those vessels. Losartan, on the other hand, is an ARB, an angiotensin II receptor blocker. It works by blocking a hormone in your body called angiotensin II, which normally causes blood vessels to constrict. By blocking this hormone, Losartan allows your vessels to remain open and relaxed. Lisinopril is an ACE inhibitor, and it works through yet another mechanism. It blocks an enzyme that converts angiotensin I into angiotensin II, essentially preventing the formation of that constricting hormone in the first place. Now, you might be wondering why I'm explaining all this chemistry to you, and the reason is simple. Understanding how these medications work gives you insight into why your doctor chose the one they did, and it helps you recognize what might be happening in your body when you experience certain effects or side effects. It's the foundation of everything else we're going to talk about today. The second crucial thing you need to know is about side effects, and I want to be very clear here. I'm not saying these medications are dangerous. They're not. They save lives. Millions of American seniors owe their health and longevity to medications like these. But like every medication, they do come with potential side effects, and you need to know what to expect. With amlodipine, the most common side effects include swelling in your ankles and feet, and I want to emphasize this because it's something I see all the time. Patients come to me concerned that their heart failure is getting worse because their ankles are swollen, when in reality it's the amlodipine causing fluid retention in the tissues of their lower legs. Other common side effects include flushing, where you feel a sudden warmth and redness in your face and chest, headaches, and in some cases, a rapid heartbeat. With Losartan, patients commonly report dizziness, especially when they stand up quickly, fatigue, and back pain. Now, that back pain is interesting because it's not always obvious that the medication is causing it, and patients sometimes go through unnecessary tests trying to figure out what's wrong with their spine when actually it's the Losartan. Lisinopril has its own signature side effect, and this one is pretty distinctive: a persistent, dry cough. It's one of those side effects that people find annoying rather than dangerous, but it's very common, affecting perhaps 1 in 10 patients. Some patients also experience dizziness with lisinopril, and there's a notable side effect that I always warn my patients about, which is hyperkalemia, or elevated potassium levels in the blood. This is why, if you're on lisinopril, we monitor your potassium levels with regular blood tests. Now, the third thing I need you to understand is dosing and how to take these medications correctly. You'd be surprised how many medication-related problems I see that are simply due to patients not taking their medications as prescribed. With amlodipine, the typical starting dose is 5 mg once daily, and it can be increased to 10 mg. The key thing to remember is that amlodipine takes time to work. It's not like an aspirin where you feel relief in 30 minutes. It can take 1 to 2 weeks for the full effect to develop, and sometimes even longer. So if your doctor prescribes it and you don't immediately feel different, that's completely normal and expected. Some patients make the mistake of thinking the medication isn't working and they stop taking it, which is a real problem. Losartan typically starts at 50 mg once daily and can go up to 100 mg. Lisinopril usually begins at 10 mg once daily and can be increased to as much as 40 mg. But here's the important part: these dosages are guidelines. Your doctor may adjust them based on your individual response, your other medical conditions, and your kidney function. And speaking of kidney function, this is absolutely critical because all 3 of these medications affect your kidneys to some degree, and your kidney function in turn affects how your body processes these medications. This is why regular blood work to check your kidney function and electrolytes is so important if you're on any of these drugs. The fourth thing every senior needs to know is about potential drug interactions. This is where I see a lot of problems, especially in seniors who are taking multiple medications. Let me give you some examples. If you're taking lisinopril or losartan and you also take potassium supplements or NSAIDs like ibuprofen or naproxen, there's a real risk of your potassium getting too high. If you're on amlodipine and you drink grapefruit juice, and I know this sounds oddly specific, but bear with me, the grapefruit can interfere with how your body metabolizes the amlodipine, causing the levels of the drug in your blood to become dangerously high. I've had patients come in with severe dizziness and low blood pressure, and when we dug into their medication history, we found out they'd been drinking a glass of grapefruit juice every morning with their breakfast. If you're combining any of these blood pressure medications with other blood pressure medications, you need close monitoring because the combination can cause your blood pressure to drop too low, which can lead to dizziness, fainting, or falls. And falls, as I'm sure you know if you're a senior or care for one, can be absolutely catastrophic. The fifth essential thing you need to know is about what we call orthostatic hypotension, which is a fancy medical term for dizziness when you stand up. This is particularly common with losartan and lisinopril, but it can happen with amlodipine too. When you stand up after lying or sitting down, your blood pressure naturally drops slightly as your body adjusts, but blood pressure medications can exaggerate this effect. So you might feel lightheaded or dizzy, and in the worst cases you might actually faint. Now here's the practical advice. Always stand up slowly. Don't jump out of bed in the morning. Sit on the edge of the bed for a minute, let your body adjust, and then slowly stand up. If you feel dizzy, sit back down immediately. It's not worth risking a fall. I also recommend that if you're experiencing significant dizziness, you tell your doctor because it might mean your dose needs to be adjusted or your medication needs to be changed. The sixth thing I want to talk about is something that's really important but often overlooked: the importance of regular monitoring. These aren't medications you can just take and forget about. You need to have your blood pressure checked regularly. Ideally, you should be monitoring it at home with a home blood pressure monitor. They're inexpensive and widely available now. You should also be getting regular blood work. I typically recommend that my patients on any of these medications have their kidney function and electrolytes checked at least once or twice a year, sometimes more frequently depending on their other conditions. This isn't just bureaucratic medicine. There's a real purpose to this monitoring. We want to make sure the medication is working effectively to control your blood pressure, without causing problems like electrolyte imbalances or kidney dysfunction. I've had patients whose kidney function started to decline on lisinopril, and if we hadn't caught it with regular blood work, it could have progressed to kidney failure. The seventh thing every senior needs to know is about what I call medication adherence, or in plain English, actually taking your medication as prescribed. This might sound simple, but it's one of the biggest challenges in geriatric medicine. Seniors often have complex medication schedules. You might be taking your Lisinopril in the morning, your Amlodipine at night, your Losartan with lunch. You might be taking aspirin, a statin for cholesterol, a medication for diabetes, medications for thyroid problems. It's easy to get confused and miss doses or take things at the wrong time, so here's my advice. Use a pill organizer. Get one with 7 days and multiple compartments for different times of day. Fill it once a week so you always know exactly what you're supposed to take and when. Set phone reminders if you need to. Ask family members to help you keep track. Whatever it takes, because missing your blood pressure medication regularly is basically asking for a heart attack or stroke. High blood pressure is called the silent killer for a reason. It doesn't make you feel bad, so it's easy to think it's not a big deal if you skip doses. But it absolutely is. We're talking about preventing catastrophic health events. The eighth crucial thing to understand is lifestyle factors that interact with these medications. Diet is a big one. If you're on Lisinopril or Losartan, you need to be careful about your potassium intake because your medications are already raising your potassium levels. So you should limit foods that are high in potassium like bananas, oranges, and spinach. That doesn't mean you can never have them, but you should be moderate. Conversely, if you're experiencing side effects like a persistent cough with Lisinopril, that's something that might not improve with dietary changes. That one usually requires a medication change. Sodium intake is important too. These medications work better if you keep your salt intake moderate, so the DASH diet or a low-sodium diet is really beneficial. Exercise is another big one. Regular physical activity helps control blood pressure naturally, and if you're exercising regularly, we might eventually be able to reduce your medication doses. Alcohol also interacts with these medications. Alcohol causes blood vessels to dilate, and when you combine that with the vasodilating effects of your blood pressure medication, you can get dangerously low blood pressure. So if you drink, keep it moderate, and definitely talk to your doctor about how much is safe for you. The ninth and final thing every senior needs to know is when to seek immediate medical attention. Yes, you need to take your medication regularly and monitor it, but you also need to know when something is wrong and you need emergency care. If you're experiencing severe chest pain, shortness of breath, severe dizziness to the point where you can't stand or walk safely, or if you faint, call 911. Don't wait. Don't drive yourself to the hospital. Call 911. If you experience sudden vision changes, severe headache, or confusion, those could be signs of a hypertensive crisis or a stroke, and again, call 911. If you're experiencing persistent side effects that are really affecting your quality of life, like that constant cough with Lisinopril or the leg swelling with Amlodipine, don't just suffer through it. Call your doctor and talk about switching medications. There are other options. The goal here is to control your blood pressure effectively while maintaining your quality of life. Let me also talk for a moment about the bigger picture. These three medications, Amlodipine, Losartan, and Lisinopril, are among the most prescribed medications in America, and that's because they work. Study after study has shown that controlling blood pressure with medications like these significantly reduces the risk of heart attack, stroke, and kidney disease. If you're a senior with high blood pressure, taking one of these medications is almost certainly extending your life and improving your health. I've seen it countless times. I've had patients who were at high risk for heart disease, and after getting their blood pressure under control, they lived years longer than they would have otherwise. That's the goal here. We're not just taking a pill, we're preventing disease and extending life. Now, I also want to acknowledge that medication decisions are individual. Just because your neighbor is taking Amlodipine doesn't mean you should. Just because your sister does well on Losartan doesn't mean it's right for you. Your doctor chooses these medications based on your specific medical history, your kidney function, your other medications, and your response to previous treatments. So if your doctor prescribed one of these medications, it was a deliberate choice based on your individual circumstances. That said, you have every right to discuss your medications with your doctor. If you have concerns, if you're experiencing side effects, if you've read something that worries you, bring it up. A good doctor welcomes these conversations. We want our patients to be informed and engaged. We want you to ask questions. We want you to understand what you're taking and why you're taking it. I also want to make sure you understand that taking one of these medications doesn't mean you've failed at health. High blood pressure is incredibly common. It affects 1 in 3 American adults. It's not about being unhealthy or not exercising enough, though those things matter. Genetics play a huge role. As you age, your blood vessels naturally become less elastic, and blood pressure naturally increases. It's just part of getting older. Taking medication to control it is absolutely nothing to be ashamed of. It's smart medicine. One more thing I want to address because I hear it all the time: the fear of becoming dependent on medications, or the idea that if you start taking blood pressure medication, you'll be on it forever. And look, sometimes that's true. If you have chronic high blood pressure, you might need medication long term, but that's not always the case. I've had patients who made significant lifestyle changes, lost weight, started exercising regularly, reduced their stress, changed their diet, and we were able to reduce their medications or even eliminate them. But here's the catch: you have to be committed to those changes. And even then, the baseline risk might still require medication. It's not about being dependent on the medication. It's about using the medication as a tool to protect your health while you work on the underlying factors. Let me wrap up by saying this: if you're taking Amlodipine, Losartan, or Lisinopril, you're taking responsibility for your health. You're taking an active step to prevent heart disease, stroke, and kidney disease. That's admirable. But to get the most benefit from these medications, you need to understand them. You need to take them consistently and as prescribed. You need to monitor your response to them. You need to have open conversations with your doctor about how you're doing on them, and you need to support the medications with healthy lifestyle choices. Please, if you found this information valuable, subscribe to this channel. I'm constantly creating content about medications, health conditions, and practical health advice specifically for seniors and their caregivers. There's so much misinformation out there, and my goal is to provide you with accurate, evidence-based information from someone who's actually been caring for patients for over 2 decades. Subscribe so you don't miss future videos. Also, please leave a comment below. Tell me what you found most helpful. Tell me if you have questions about your specific medications. Tell me what other health topics you'd like me to cover. Your feedback helps me create better content that addresses the real concerns you have. This community of people taking charge of their health is what makes this work worthwhile for me. Thank you so much for watching, and I'll see you in the next video.